Can you hear this? Is this working? This is working, okay. Mr. Sheldon, if you could give us an update.
Pleased to advise that we do not have an addendum. We do, however, we have scheduled a special committee of the whole closed session following the council meeting to deal with two items. The first one dealing with a property matter and security of property of the municipality, and the second one to do an update regarding the litigation associated with Glenway. Any questions on the special committee of the whole meeting?
Now, how would we introduce that, or do we introduce that during council? We don't? Okay. So this meets the notice requirements?
Yes.
Okay. That's what I wanted to know. All right.
Potentially ratifying the committee of the whole, if any decisions at the council will recess. Is that how it's going to work?
Well, the normal process, and I wasn't sure, but the normal process would be that this committee of the whole, this evening's special committee would go to the next council. Would that be?
Yes.
That would be the normal expectation, unless there's a constraint that requires.
Yeah, in both cases, Mr. Mayor, these are updates, so we don't anticipate the need for that, but if something comes up, either it can go to the next council meeting, or if it's time sensitive, there may be the need to call something before.
Okay. Hi, Joe. Let me turn this off and we.
Over to the hot seat. I live in Ward 2, running for council in Ward 2. I've watched with great interest for the last 9 months or so about all the requests for information about the Newmarket Soccer Club loan. And it just seems like I'm a glass half full kind of guy, but we just cannot seem to get any answers. And I'm not here to ask those same questions again. What I want to know tonight is what aspects of this particular I hate to call it a deal, but this agreement with Newmarket Soccer Club are not available for public consumption, and why?
Okay, there are some transactions that involve property, and property matters are of private nature. But the good fortune is that you can get an update on our most recent information report, number 2014-12, dated April the 5th. And that will give you an update as to the situation and the ability for the soccer club to meet their payments and what they've done in terms of meeting their obligations under the loan agreement. When situations that have commercial value are being negotiated, until those items are finalized, those matters are private, and it's quite appropriate to do that with those matters under the Municipal Act.
Can information not be released that's redacted, that avoids releasing sensitive information but reveals other details that wouldn't upset that protocol?
I haven't given that any consideration, but it probably would be redacted to the extent that it wouldn't be meaningful information. But that might be something we could consider.
And in terms of this type of an agreement, do you feel this opens the door to other groups coming and seeking assistance, and it sets a dangerous protocol to be supporting community organizations that should be able to stand on their own?
I don't think that we can make any presumptions. We'll have to deal with each situation on the basis of its own merits, and that was the basis on which we made the decision for the soccer club.
Okay. Those are great bits of information. And another matter, what happened to the 5,000 people in Newmarket that have gone missing, depending on which part of town you come into? The population signs
Oh, yeah.
don't add up.
Yeah, it's not a priority from our point of view as to whether those signs, in fact, I even suggested at one point in time we just take those numbers off, because the amount of time and effort that's taken to put the numbers on those things, your return on effort, to me, doesn't have a very good yield. So the region does change those signs from time to time, and it simply hasn't been a priority, to be candid. Mr. Sheldon?
I've been to Europe, and what they use is census numbers and say, as of census
Yeah.
2012, this is our population, because I think it gives people a sense of worth of their community, the size of the community when they're entering it. Are they entering a 2-gas station town? Are they entering a major city? Because we don't market ourselves very well coming in off the 404. You look at the way Aurora presents itself with its signage, et cetera, and Newmarket, you really don't get that sense that we're such a big town.
The municipality is working on some signage that is more than just those signs, and it's more than just the number sign underneath the Newmarket thing. But I will turn that over to Mr. Shelton for a second, and the Regional Councillor and Councillor Hempen have a question, and we do have a 5-minute limit on these. Yep. Go ahead, Mr. Shelton.
Yes, thank you, Mr. Mayor, and I'm sure the Commissioner could confirm this, but we deal with a couple of different jurisdictions in terms of those signs for population, so it is a continual effort to try to get them in sync. We deal with the Ministry of Transportation plus the Region of York, so that is a challenge. On the entrance signs, the entrance feature, that is something that staff have reported to Council on. Council has given us some direction. We're looking at establishing, for the most part, if not entirely, some funding that is not coming through the regular capital budget, but would be coming through voluntary contributions, et cetera, from developers.
All right, terrific.
Thank you. Regional Councillor?
Yeah, so the population signs also, there's 3, one's municipal, one's regional, one's provincial, and they don't always, the province is very hard to get to move on a schedule that's other than their own. So I do want to make a comment, though, about the soccer loan. I think it's important. The key details of the soccer loan were all in the motion that was passed in public immediately after coming out of camera. Every key detail of the loan is in that motion. There are certain things around the valuation of the collateral properties can't be disclosed because it could impact the valuation of a potential sale. So there's some things that are in the best interest of the soccer club and frankly the town to not be disclosed. But everything else that is there is all out in the motion, and we've just had a detailed report recently. We've had one before that, and one before that. So I think the perception that there is a great deal of information missing. I think if you look at those reports, and particularly that original motion that laid out all of the key details, the interest rate, the collateral properties, the length of the term, on and on and on, it's all there. The need, the requirement for a member of our organization to be at meetings. So I think what I would say is very little is not included, and that's not included is done so in the best interest of the residents of Newmarket and the soccer club.
All right, well, I guess I'll wrap it up here, but say that I think a lot of people felt that protocol wasn't being followed by the speed of the deal, and now the information's coming afterwards, and that's terrific. But when that agreement came out, there just seemed to be precious little could be spoken about it other than it was done.
Actually, every key detail was in that motion immediately following the in-camera decision, immediately, in the same evening.
All right.
I think there's a lot of perhaps confused information that's out there around what details were not disclosed. All the key details are there.
All right, terrific.
Thank
Thanks
you.
for your time tonight.
I'll send them to you if you like.
Okay.
Thank you. Councillor DiMuccio?
Thank you. I'm sorry I missed the beginning of your presentation, but I'm going to have to disagree with Regional Councillor John Taylor. Not all the details were brought forward to the public. In fact, I had to fight to make that motion alone say that what it said about that, in fact, it was a soccer loan, because it would have said acquisition in Ward 1 had I not fought for that. There was also an FOI request made by the public. That FOI request was on the documents that do exist. That was refused. So there are documents that do exist that are not available to the public. Regional Councillor John Taylor's opinion is that those documents are to protect the public. I disagree with that, but I just wanted to make that known.
Thank you.
So that's where redacted information might come into play in that FOI then, yeah?
Okay, thank you. Unfortunately, we are into the beginning of the council meeting.
Oh, you do have them? Okay, so you can do that then, right?
I got a minute? How we doing?
Good evening and welcome to the council meeting of the town of Newmarket on Monday, April the 14th, 2014. All members of council are present. Mayor Van Byen is presiding.
Thank you, Mr. Clerk. There are no matters of public notice. There are no additions or corrections to our agenda. Are there any declarations of pecuniary interest with respect to the items that are defined on the agenda? There being none, we'll go forward to our presentations. It's an opportunity to welcome Dr. David Williams and Helena Hutton. Dr. Williams is the President and CEO of South Lake Regional Health Center, and Helena Hutton is the Chief Operating Officer. Welcome, Dr. Williams and Helena.
I'd like to thank the council for having Helena and I from South Lake to be able to present tonight, and thank you for all the members of the community. We're very proud at South Lake to provide world-class health care close to home, and tonight's presentation will give you an update on what we've been working on in the hospital and our recent strategic plan.
Now, I understand this is going to take more than 10 minutes, so I'd like to have a motion to extend. Councillor Emanuel, Councillor Twinney, all those in favor? That is carried. So this gives you enough time to finish the presentation.
Excellent. Thank you very
Thank you.
much. So we've just released our new strategic plan about a year ago, and we're in the process right now of realigning the structure of the senior team to be able to align to the new strategic plan. You're going to be seeing announcements in the media about a new Vice President for Human Resources that's joining South Lake, and also a new CFO that we have to join South Lake as well. But the presentation that we'll talk about tonight shares a little bit about the new strategic plan, where we're going, and some of the achievements that we've been able to have over the past year or so. Our vision, quite simply, to deliver shockingly excellent experiences to our patients, our people, and our partners. And this is something that we take quite seriously. In fact, we had a team from Australia visiting Canada, and they came to Toronto about a week ago, specifically to come up to Newmarket and see what was going on at South Lake from a perspective of the new way in which we're able to deliver shockingly excellent care. So the brand that we have at South Lake, these shockingly excellent experiences, is something that we're very proud of and is now becoming recognized globally. We, of course, define shockingly excellent for our team, and we talk a lot about the culture that we have. But basically, we strive to exceed the expectations of our patients and their families, and to make sure that every experience that people have in our hospital is a positive and a pleasant one. And that's something that we work very hard to be able to achieve. We have tremendous support from the community and a number of positive comments that we get every year. And when we have opportunities to improve, we engage patients firsthand to be able to learn what we might be able to do to meet their expectations better. Our strategic plan is broken down into three primary areas. The first is to create the ultimate hospital experience. Again, this is not just for patients and families. This is for our partners, and we want to be able to develop relationships with community-centered care organizations, relationships with other hospitals within the LHIN, and relationships with other hospitals outside the LHIN. And we're very excited about this because I think overall, to create value in the healthcare system in Ontario, we need to develop these collaborative partnerships between institutions. Our last strategic direction is something that we're very excited about, and that's to seek and share better solutions. So we try and create new solutions to problems at Southlake. If we can't find them, we would then reach out into the healthcare system within the province, within the country, or internationally to find solutions. And in the presentation tonight, we'll share two of those solutions, one of which is a grown-at-home solution to enhance hand hygiene within hospitals, which we believe is spread throughout the province. And another one is an idea that we borrowed from the NHS in England. We implemented at Southlake, and I think we've been able to do that with tremendous success. Our mission, essentially the task by which we govern ourselves every day, is to work together with our patients, our people, our team members at Southlake, and our partners to make lives better by creating greater value in healthcare. Those quality outcomes are fundamental to what we're doing at Southlake. We describe the culture at Southlake, the way in which we deliver healthcare, as the culture that characterizes our compassion, our innovation, our commitment to excellence. And just last week I was up giving a keynote presentation to Accreditation Canada, celebrating the achievements of linking culture to safety and quality objectives. So again, we're getting recognition on the national level for that. The four key elements of our culture are our values. So these are the ways in which we live on a day-to-day basis. We, of course, put patients first. We're innovative, so we're continuously pushing the envelope. We honor our commitments, and we give a damn. We're passionate about what we do. And I'm very proud to be able to say that, because many people know of us not as a shockingly excellent hospital, but those folks that give a damn about healthcare. And I think that's very important when we talk about the safety and quality of our patients. So I'm going to turn it over to Helena Hutton, our Chief Operating Officer, to speak to some of the details of the initiatives that we've been referring to.
So thank you for inviting us, and it's my pleasure to be here to talk about some of the quality and process initiatives that we've overtaken over the last few years. So Southlake, as you know, is a large regional center, and in fact, although these numbers are from 12-13, in almost every aspect our numbers have continued to grow. Our emergency now sees more than 100,000 patients a year and is the 5th largest in all the entire province. And I'm privileged to say that our emergency also was recently recognized as #1 for the pay for performance initiatives that the province sponsors. So we are all about bringing world-class care closer to home. And we're thrilled that we have our cardiac center and our cancer center amongst a number of our regional programs that have quality parameters and have objectives and outcomes that are second to none. Our EP program is electrophysiology program, so that's the electrical portion of the heart rather than the physical pumping of the heart, is the largest in Canada, is well recognized around the world for the first that we have done at Southlake. So we have about a $340 million budget. And as you can see, our salaries and benefits are our largest component. 65% of our costs and expenses are to salaries and benefits. And that's created some challenges for us as we're moving forward and as we need to continue to really drive out efficiencies in our zero-based budget or a 0% increase yearly from the Ministry of Health. And as you can see, the Ministry of Health is approximately 85% of our revenue. So our emergency, it says the 7th largest, but again, we just got our information, so we're now the 5th largest in Ontario. We're the largest in our Lynn and York region. And our growth from 9-10 to 13-14 has been more than 23%. And part of that is our challenges of the future. We were built to see a maximum of 80,000 patients, and we're seeing 100,000 patients, and yet still we were able to have efficiencies which ranked us first in the province. Alternate level of care, that's ALC we use. These are patients that no longer need to be in acute care and require some other kind of care. So care in the community, care in a different kind of bed, perhaps a convalescent bed or a rehab bed. And this is something we have been working on with our community partners and our other hospitals across the LHIN. But as you can see, over 10, 11, and 11, 12, the number of beds that were blocked for acute patients continued to increase, and we've had a number of initiatives that have decreased that over the to 12, 13, and 13, 14 years. And this has allowed us to repatriate our beds and use them for acute care patients, the things only we can do. And it's really important to make sure that patients transfer home as quickly as they can in order to facilitate their care. It's not about getting them out of the hospital. It's about making sure that those patients in Emerge who really need our acute care have the opportunity for a bed. So one of the models we have used, MACU, we're great at acronyms in the hospital, so that stands for the Medical Assessment and Consultation Unit. This was a model we stole from the health system in the UK, the NHS, and it's a model all about front-loading care. So for patients that come in from the Emerge, particularly, go to this unit, and they have all of their care done in a matter of hours rather than days. So the physician and the team work all together. If they need their CT, it's booked for that day wherever possible. It's not booked for the next day or the next day, and we deal in hours. And we've been able to actually increase the amount of throughput, increase the acuity of patients, but decrease the number of beds we need to be able to take care of these patients. It's also really important because as patients get older, the length of time when they stay in the hospital, some patients will continue to become increasingly confused or disoriented, and particularly day 4 in a hospital stay is when they, some patients move to that confused state. So if we can get them up and home safely before day 4, we are really helping them recover long term. All of these initiatives have resulted in us having a very favorable cost per weighted case. So every patient in our hospital has a weighted case associated with it. So the cardiac case is a very high weighted case. A day surgery tonsil is a very low weighted case. And the parameter that you're seeing here is our cost per weighted case. So we're proud that we've been driving down our cost per weighted case, increasing our efficiency with the dollars that we're using, and we're continuing to track out to 13, 14 to be at that same rate. And this is really important as our hospital funding formulas change over time to be as efficient as we can. So turning to some of our quality initiatives, our hand hygiene we're proud of. We're at 92% as of last year. We started out in the 60s with the rest of the province, and we have been a real leader here. We do 40,000 audits annually, so we know these numbers are reliable and valid. We also, as you can see, we congratulate those who have reached 100% hygiene on a weekly basis. And by portfolio, we have we identify where everybody is. So this is open, transparent. This screen capture is on every screen in our hospital, every computer screen. We've actually transitioned to a new computer system, but every unit knows where they stand on their hand hygiene, and it's really illustrative. We had an internal outbreak, so an increase in some infection control, yet we had no staff sick relative to the hand hygiene. So it's a great testament to our hand hygiene actually working. We have a whole quality improvement plan, which is presented on our inter and intranet site. And these are our 4 quality indicators for the fiscal year just finishing March 31st. So our ischemic stroke length of stay, we are green in our quality indicator, meaning we had a targeted length of stay and we've achieved that targeted length of stay. Medication reconciliation is, there's 2 parts to medication reconciliation. The first part is getting great medical history on what meds you are on. And the second part is making sure that when you're admitted into the hospital, we've taken account for all of those meds. Those two pieces together are a medication reconciliation. And again, safe transitions in care, that's important. So we've met our target there. C. difficile is an infectious bug, and we have created a target of 0.35, and we've exceeded that target as well. So again, that's related to hand hygiene, and not only just hand hygiene with the spritzing, but hand hygiene with respect to washing your hands and a clean environment. One that's still red for us is our hydromorphone incidence. And hydromorphone is a drug that's 10 times more potent than morphine, yet is mixed up with morphine. So we've had no critical incidents. All of our incidents have been good catches relative to our hydromorphone, but nonetheless, we want no medication incidents relative to hydromorphone. Hydromorphone is one of a drug that the Institute for Safe Medication Practices has identified as a drug that across Canada everybody needs to look at what are the safe practices. So we have a number of initiatives, and this is going to be a carry forward for this fiscal year, a number of initiatives to have our hydromorphone incident decrease. Some of those initiatives include double checking, so having 2 nurses double check even though it's not legally required, and having starting at a decreased dose. Overall, one of our big dot items is what is called the Hospital Standardized Mortality Index. And what this shows is for all the patients that come into our hospital, if 100, based on the complexity of case and all of the conditions that are wrong with them, if 100 patients were to come, or of the 100 patients that are expected to die, if you were to sit at 100 for your Hospital Standardized Mortality Index, you're neither saving lives nor having more deaths than anticipated. So our Hospital Standardized Mortality Index is at 67 as of the last information. So in essence, we have 33 patients that were expected to die coming into our organization that did not die. So the lower you go, the better you are. The top 5 performers in all of Canada are 75 or below, given the last information we had available. And this is about to be nationally released again. So we're proud that all of the quality indicators coming together make to this big dot item.
So we're very grateful for the support of the community. We have a tremendous community, and as we mentioned earlier, we're committed to delivering world-class, high-quality care close to home. But to do so, we rely on the philanthropic support of the community, both Newmarket and the catchment area for South Lake. So we're in the midst of a number of campaigns right now. We're just finishing off the diagnostic imaging campaign, and after that we'll be about to embark on a hospice campaign to create a 10-bed hospice for the hospital. But we do have a number of other annual capital requirements. And of course, these are the ongoing equipment needs of many hospitals, not just South Lake, but all hospitals in Ontario. And essentially, we're looking at funds for informatic technology. We have dated anesthesia machines, which are aging, which we're going to have to replace down the road. We're trying to create a medical clinical equipment fund to be able to replenish equipment in the hospital. And we're very excited about the opportunity of creating a cardiac innovation fund to keep us at the forefront of advanced cardiac procedures. And when Helena mentions that we have the largest advanced electrophysiology program in Canada, that's mind-boggling. It's not UHN, not St. Mike's, not the Ottawa Heart Institute, not Vancouver General, it's South Lake and Newmarket. And that says something because we have Cleveland Clinic and Mayo Clinic looking at what we're doing from a quality comparison perspective. So we're very excited about staying at the forefront of cardiac. So the campaigns, we mentioned Images for Life Hospice. As we look down the road, we're envisioning a campaign to replenish the operating rooms, to look at the emergency department, expanding that to provide better mental health treatment facilities for inpatients and also for patients in the emergency room. We like to think that there's lots of great opportunities for naming programs. So right now it's the 10th anniversary of our cardiac program. There's a huge opportunity for all of us to work together to identify a potential donor that would be interested in having the program named after them. But it's not just large programs. It's simple things like the emergency room, operating rooms, different parts of the hospital, and many of the downtown teaching hospitals work very aggressively with the community to have naming opportunities in addition to all of those. And lastly, from a philanthropic area, we're thinking about funded chairs. So one of the goals that was given to me when I came to join Southlake was to increase the engagement and the involvement of Southlake in academic activity, and the way in which we do this with the University of Toronto and other universities is through funded academic research chairs, which we feel would be appropriate in areas of wellness. This would be a family practice primary care funded chair, eating disorders in our psychiatry mental health program, and of course a funded chair in electrophysiology. So we're very excited about what the future might look like. We're widely recognized in Ontario as being at the forefront of trying to link the requirements of healthcare with the development of new technology. And as a result of this, I was asked by the Minister of Health and the Minister of Research and Innovation to chair the Ontario Health Innovation Council. But we've created a Health Innovation Accelerator in Newmarket on Davis Drive in our Tenetronics building called Create IT now at Southlake. And we believe that there's a lot of exciting opportunities to leverage the creation of new medical devices, the commercialization of these devices, to create local economic growth within our community by creating new jobs and economic growth. So we're really excited about where we're going. We've won a number of awards. We've won the Canadian Health Informatics Association Award for the use of the McKesson patient viewing system, and linking this essentially large television screen that gives us a real-time portrayal of the beds and the availability of beds. We've linked to that safety and quality initiatives. Patients who are at fall risks are identifiable on this TV monitor, and also our hand hygiene score is displayed there weekly. So we've won a national award for that. We just won one of Canada's 10 most admired corporate cultures in the lower right-hand corner. We also won the Passion Capitalist Award. And I think that speaks to our give a damn passion. We're very passionate about what we do, and we link that passion to safety and quality. So that's why you see HSMRs of 67, which is quite an amazing number. If I were to go into the senior team of the hospital and direct them to lower the HSMR, that's a real challenge to be able to do. You achieve that number by having hundreds of best practices that our team members incorporate every day in how they take care of their patients, and that's how you get an HSMR of 67. We're one of the GTA's top employers, and we've also been accredited with exemplary standing. So we're very excited about the changes that have taken place in the hospital over the last 3-4 years and the direction that we're going over the next 5 to 10 years. So we'll pause there and open it up for questions. If anyone has any questions about anything that we presented tonight, we like to say we have a completely open and transparent corporate culture. So truly anything that you would like to ask about or wish to share about our clinical performance, we'd be willing to entertain.
Okay, thank you. I have Regional Councillor Taylor in the queue.
Thanks very much. Thanks, Dave and Helena. I think it goes without saying, but it needs to be said how incredibly proud and fortunate we are to have you in our community. And I think it would, I'm sure everybody has the same experience where we just get continually positive feedback from the residents of Newmarket to us about the experiences they have at Southlake. So thank you for all the exceptional work that you've done. And I do have two quick questions. The one is, are you able to provide this time any more detail on the hospice and the timeline on that, or even desired timeline?
Yeah, so we're going to give a presentation to the LIN in about 2 weeks or so, and the desired timeline is in the 15-16 time framework, so to start construction in 15 and hopefully have everything finished by the end of that year or the beginning of 16.
Okay.
But we're working very aggressively towards that. It's something that we feel is critical in terms of the needs of our community, and to be able to provide residents of our community with an opportunity to have a quality end-of-life experience. And hospices are so critical for that, so it's a high priority.
Yeah, it'll be an important addition to what you offer in the community for sure. My other question is actually a curiosity question, but you referred to it as HSMR. Can you pull that slide up quickly? I guess what I was curious about is, obviously, what you've achieved there is exceptional. If there's the top 5 or 75 or below, and you're at 67. But I've got to assume, as you said, getting that number down is not an easy thing. How did you manage, because I assume that's South Lake's numbers, to go from 2009 to 14, from 107 down to 67? There must be a story there, because that's just, my gut instinct would have thought that even with a lot of work, it would have been a more gradual line. So.
Yeah, great question. So there's no question there is a story there, and that's the story that I was sharing with Accreditation Canada last week, because people are very interested in healthcare and delivering quality and making that sustainable. So what we've done since my arrival at South Lake is take the principles of high reliability organizations, which is fundamental in the aerospace community where I used to work as a leader, and bring that into healthcare to create high reliability healthcare. And we're aspiring through our culture to create a positive peer pressure model. So hand hygiene is a great example of that. The month before I started, we were at 59%. Aggregate year to date, we were at 69%. That was July 2011. By November 2011, we were at 96%. Now we bounce around between 90 and 95%. So the HSMR is a combination of your hand hygiene protocols, how you deal with controlling C. diff within the hospital, quality best practices like safe surgical checklists, preoperative antibiotic use and things. And when the Fifth Estate came in and did the big review of hospitals, we actually got a C on our scorecard. So I was interviewed by the Barrie newspaper about why did South Lake get a C. And I said, you know, we're an A hospital that got a C grade. And the reason why we got a C grade was our 5-day post-operative mortality. So if you actually look at the numbers, and I was able to chat with Fifth Estate about this, we had 21 patients die. But again, using the idea of the hospital standardized mortality, one could ask the question, of those 21, how many were actually expected to die? And in 17 of the 21 had what's called an ASA class 5 anesthetic risk, meaning that they would have died had we not attempted surgery on them. So when you actually start digging into the numbers, we weren't as bad as it made it sound. And then, of course, we pulled out our HSMR data and we said, how can we have a 5-day post-operative mortality that you think is a problem when, in fact, our hospital standardized mortality is on the decline and now we're in the top 5 in Canada. But it's a confluence of everyone in the team working together with those quality best practices that enable us to do this. And, of course, you don't achieve this over 1 year. The curve is going like that because it takes time to implement all the quality best practices.
Thank you.
Thank you. Councillor Twinney.
Thank you. Thank you for the very informative presentation. I think it's important for this to be presented to the town of Newmarket because I think we all sort of take it for granted. You know, it's just South Lake, it's there, and it's a great hospital. We all know that, but it's important to see really what's behind it and what's been going on and why we're such a great hospital. So thank you for the presentation. I would love to get a copy of it myself if you're able to do so. That would be wonderful. I do have a question, and you referred to it a few times about hand hygiene, doing a hand hygiene audit. Exactly how is that done? How do you do an audit?
Yeah, great question. So I'll answer first, and I'm going to ask Helena to answer as well. The answer that I'll give you, Helena will speak to the details of how our auditors do it. We actually look at the numbers. So if you were to go and ask any hospital CEO in Ontario, do you have good hand hygiene scores? The answer, of course, will be yes, right? Who's going to say no to that one? And then if you ask the next question, well, what is your hand hygiene number? Most CEOs will say it's very good. But no, we really want to know the number. Well, we'll have to check and get back to you. We expect that every member of our senior team know the number, be able to quote the number, and that number is based on reality by doing 40,000 audits a year. In some publicly reported quality metrics, only one step of the hand hygiene process is actually reported, whereas we audit and report both steps. So if you don't wash your hands, if you only wash before you contact the patient and not after, you don't pass, and that's not counted. Whereas in other institutions, if you do one of the two, that will actually be counted. So we're actually trying to be completely open and transparent and transform the way in which we're doing this. Helen?
So we have, and in our organization, we have hand hygiene champions who are actually certified of how to make sure that they are auditing. And we have now a device, or you can have it on any device, like your iPad or BlackBerry, whatever, and they actually sit and watch. Patients or staff go into the room. Everybody from nurses, cleaners, the people with the linen carts, whatever. If you are approaching in the patient room, you're expected to follow the same protocols relative to hand hygiene. And we do audits across the entire organization as well, and in our outpatient areas as well.
Great.
So it all goes in real time to the data bank. It's really important, like I'm a certified hand hygiene
Right.
champion and auditor, and so people see me out with my BlackBerry when I'm there. Might be two or three
Right.
when I'm visiting, but it's important that people see that I'm doing the audits and I'm also spritzing and doing
Right.
the hand hygiene as well.
That's great. Well, thank you very much. I just have to make one comment. My father is actually there at South Lake. He had to be flown home on Friday after having a fall, and so he's actually watching tonight. And I said, what a great night to watch. We're actually having a presentation by the president and the CEO, so thank you very much.
Our pleasure.
Thank you. Councillor Manuel?
Thank you so much, David and Helena, for the presentation. The question I have, now that the Stronach Cancer Center's been open now for a little while, I know that when the argument to develop it at the time was really empirically driven by the numbers and the cancer incidence in York Region, and I just would love to get a snapshot from yourselves. Are we meeting expectations on the input? I know that there was also space put aside for future bunkers, and would love to just have a sense of how that facility is working, and if it's if they're being overwhelmed, or and I guess where the numbers are.
Yeah, so there's been continuous volume growth. I'd say that the response from patients and families has been overwhelmingly positive. If you have a chance to visit the cancer center, it's worth a visit, because often people ask about the environment that healthcare is delivered and whether that makes a difference. There's actually very compelling clinical data to show that patients do better in a more restful and relaxing environment. So we have a waterfall in the cancer center. We have fireplaces in the waiting rooms, open lighting concepts with large windows, and patients who are getting their chemotherapy actually have a relatively pleasant view out the window while they're getting their chemotherapy. And there is good sound medical data to show that makes a difference, improving clinical outcomes. There's been significant growth. We're hoping at some point in the future that we'll get funding for our fourth bunker and be able to increase the service that we're providing there. But through our collaboration with Sick Kids, we have the pediatric oncology program at South Lake, all of which is designed to provide sophisticated levels of treatment close to home. And POGO is a great example of this. We could pick other areas of cancer, but there's nothing more compelling than kids who have cancer and wanting to make sure that we're providing them the right treatment in a timely manner close to home. And many of the parents of these kids used to actually have to take their child from Newmarket, drive down the 404 or the 400 to go to Sick Kids and to try and find a parking spot at Sick Kids, wait for treatment, you get the chemotherapy, you get back in the car and you're driving up the 404, and as we all know, one of the side effects of chemotherapy is nausea and vomiting, and your poor child is throwing up in the back seat of the car while you're stuck in rush hour traffic trying to get back home. Our sense was that this is unacceptable. So we worked with Sick Kids to have an outreach program. It's called the Pediatric Oncology Group of Ontario, Pediatric Outreach for Oncology Patients. And now these children are able to get the same chemotherapy they would get at Sick Kids here at South Lake through the partnership that we have with Sick Kids. So that's what we're talking about with that third strategic direction, the second strategic direction, about creating those partnerships and finding better solutions for the community. So it's working very well, but you'll see the same growth curve that we saw for the emergency room. If you look at any of South Lake's clinical program, the growth curve's essentially the same. It's nonlinear, we're growing exponentially.
Thank you. I also want to express appreciation that you included council and staff some time ago in the development of the strategic plan. We had the workshop at your office. So including the community, I think, is important, and I do appreciate that. Thank you so much. And I think we'd be remiss, too, if we didn't congratulate you on your recent induction to the Order of Canada.
Oh, thank you.
For all your shockingly excellent contributions to medicine and aerospace. So we're lucky to have you at South Lake. So thank you, David.
Well, thanks very much. And if I might share, the most amazing experience I've had in my life is flying in space, riding on the end of the Canadarm. But the most meaningful experience I've had in my life is working in healthcare as a healthcare professional, working with people like Helena to be able to improve the quality of lives of our patients in Newmarket. And it might sound a little bit trite. I don't mean it to sound that way. We're completely dedicated to it, and it truly has been the most meaningful experience of my career.
Thank you. Councillor DiMuccio?
Thank you. Thank you both for your shockingly excellent presentation tonight. My father was a recipient of a quadruple bypass surgery a couple of years ago, and I can't emphasize enough how amazing your hospital was throughout the entire ordeal. So thank you. And I am the mother of 3 children, 2 of whom were born at your fine hospital, and the second one whose life was actually saved at the moment of birth because of a complication, so that's wonderful. My question is probably a little bit too general, but if you were to say what one of the most biggest issues that you have going forward into the future of healthcare that your hospital faces, what would it be?
That's a great question. So, you know, the easy one is to talk about resources. But arguably, I'll maintain that at a provincial level, I think there's probably enough funding for healthcare. It's how we're using it, how we're distributing the dollars within the system, and how we can leverage the way in which we're delivering those dollars. You know, one of the interesting challenges that we face is changing the way in which we deliver care and understanding what hospitals are there to do. Ideally, hospitals are places for acute diagnostic and therapeutic services, what we talk about in the MACU, where we're able to quickly get on top of a medical issue and then figure out where the person is best suited to get that care. And what we've learned is, in many cases, care at home is the model. So we're working really closely with CCAC, but I think all of us in society need to understand our expectations for the aging process, what normal aging brings in terms of wellness and challenges with disease, and what an end-of-life experience might look like. So I think it's very important for us to work with primary care physicians in the community to be able to have them proactively working with families and patients to be able to identify what will happen when mom or dad aren't able to drive their car anymore. Because you know what? It's going to happen to all of us. So thinking about those sorts of things ahead of time really helps a family be able to plan. So we want to work with team members in the community, work with CCAC, work with other community-based partners to help patients and families be able to address those issues. Helen, did you want to?
I would echo the same comments. I believe we have enough funds, and I believe that we need to engage in a very different way about what health looks like across the entire spectrum and start treating the entire patient, not the disease entity. And I'm really proud in some of our quality initiatives, in fact, all of our quality initiatives, we're looking at the entire patient, not the disease.
And just one thing on the funding piece, you know, healthcare, our revenues are frozen, right? We have a 0% increase. So right now we've been able to make it work by improving efficiencies in the hospital, and we work very hard to be able to do that. At some point down the road, we'll have to reassess that. And of course, that's going to be done at the provincial level, and the decision will have to be made. But again, the situation we find ourselves in right now is really pushing everyone in healthcare to create value through efficiency. And there's a lot of efficiencies to be gained in the system. So we're working on that as well. And we're proud to report our cost of delivering care is the lowest in the LHIN. And that, again, we changed that over about 2.5 years.
Well, now I like you even more. That's a great answer. Thank you.
Thank you. Councillor Sponga?
Thank you, Mr. Mayor. For you, thank you, Dave and Elena, for the wonderful good news presentation this evening. I just want to build on some of the comments from Councillor Emmanuel. I've had an opportunity to tour the Stronach Cancer Centre with a number of international oncologists, and I'm just going to build on the comments that they were very impressed with the facility, and especially in terms of facility, what can be provided for children, how comfortable the facility is, the use of materials, and so forth. And I can attest to the fact, to your hand washing initiative, because having a family that goes from 81 to 10, being in a number of different departments of the hospital, and you guys are hands crazy. There's posters about washing for staff to wash their hands everywhere. So kudos on that one. You gave us a wonderful picture of the shockingly great care and great experiences you're creating in terms of healthcare. But I think the great story also for Newmarket is in terms of, and from us, the council, I think it has, it resonates, is the economic development spin-off and the great story there. You talked about, you know, your some of the challenges around meeting your salaries and benefits and so forth. But could you give us an idea how many jobs the South Lake, and you might have touched it in your presentation, I might have missed it, but how many jobs you're actually providing for our community, and what, I don't know if you have that sort of detail, but what is the level of economic spin-off that you've provided to this community? It must be incredible.
Yeah, so that's a great question. So in terms of jobs, we're the biggest employer in the region, actually. And what is our total staff number? It's 2,500 in that ballpark. So we've got South Lake staff, then we've got South Lake physicians, then we've got the volunteers, and our volunteers are up around 1,000 right now. Total it all up, we're talking about 4,500 people. Now, the Technology Innovation Accelerator, right now that's very early in the idea stage, but it's to take the requirements that we have. So Helena mentioned the app that was developed for hand hygiene. That's a commercializable product, right? So you could create a startup company and be able to leverage that and hopefully create new jobs. So we're working very closely with a number of IT companies in the area. Tree Frog, we usually cross paths about once a month, once every 2 months or so. And again, it's partnering what we're doing with what they're able to do to create economic growth and development. And you'll see that in the downtown teaching hospitals. St. Mary's and Kitchener-Waterloo developed an app, which they're now commercializing. We are working with a company called Patient Way, the kiosks that we have in the hospital. We actually have intellectual property on the software inside the kiosks, so we have a revenue stream, very modest. It's exceedingly modest, but it's there. So I think that's the metaphor for the future. And when I wear another hat and I sit at OHIC as the chair of that council, what we're looking at is literally taking the requirements of healthcare and partnering them with private sector companies to develop new commercializable technologies. And we look to other countries like Israel or Finland, where we were able to be part of a joint economic development tour, and you go and you see how you can basically take the requirements of new technology and create new growth opportunities and transform communities. Mm-hmm. So I think that's something that is really exciting. You know, we're at the early stages of this right now, but I would argue that Newmarket in 10 years is going to be different than it is today. Certainly Davis Drive will be quite different. Tenetronics building, we're hoping, will be the home of Create IT Now, and that will be a partnership that represents engagement of universities within the community, but also as an opportunity to create new businesses. And you know, there's a high school up the street. And wouldn't it be great to have high school students participating in the development of new handheld apps? You know, these things in the Apple platform, they sell for 99 cents each. I once gave a talk at Queen's University to first-year computer science students and asked them, how many of you are making money on the side by selling apps? 30% of the room put up their hand. So there's great opportunities. You don't have to have big infrastructure. You know, you can have small startup companies that are run at home or run virtually where you're able to succeed. So we're excited about the vision.
Great, thanks.
Thank you, Councilor Bay.
Thank you very much. Dr. Williams, Helena, you've heard it a number of times, but I'm going to say it. It's so wonderful to have South Lake as part of our community, both on for the clinical benefits for the town, quite frankly, that for most people in Newmarket, South Lake Hospital is only a few minutes away. And that's an incredible convenience that you don't have in most parts of Canada, quite frankly. So we're very fortunate for that. I would like to, at some point, have you come back and talk more about the economic impact of the hospital in our community. $344 million operating budget, the multiplier on that must be phenomenal. And to have and also with what we're doing on Davis Drive, and quite frankly, the type of businesses I think we're going to attract, because they all want to sell goods and services to you because you have a significant budget. We really want those type of jobs here in the town. And you know, right now we're looking at about 2,500 staff at South Lake, but I think we're going to be on Davis Drive and leveraging, quite frankly, your operating budget. I think we're going to be bringing in hundreds of more jobs, too. And also, I just want to speak a little bit on the clinical side. You know, my daughter was born there. 4 weeks ago, I was in South Lake for a significant surgery. Many of my council colleagues know about that, and the surgeon was Dr. Davids. And it was wonderful care, just from personal experience. And I was in and out very quickly, much quicker recovery time than I thought it would be. But something I'd like to ask you about, because it's one thing that we hear a lot about in the newspaper, and sometimes it's people's, certainly the most frequent experience with the hospital as a patient, is in the emergency department and your wait times. My daughter was there about 3 weeks ago, and you have so many people coming in. It's not critical. Many people are obviously coming in critical, but so many are coming in that's not critical, but they're in great discomfort, they're stressed. moms, parents, dads are sometimes a little bit stressed too with their children there. Can you talk a little bit about your emergency department and how you've got that organized and the type of respect and care that you're showing for the patients coming in there? Because, again, it's the most frequent patient clinical contact most of us have with the hospital.
Yeah, great question. So we're in a process right now of trying to change the way in which we're delivering care in the emergency department. Over the past year and a half to 2 years, we've been very focused on flow. The medical assessment consultation unit is one example where we can move patients out of the emergency department into the hospital quickly. But the reason why we're focusing on this is at any given morning in the emergency room, we can actually have an inpatient medical ward and an inpatient mental health ward. So for instance, this morning, we had 33 admitted patients in our emergency room. And that reflects the volume of patients that are coming to the emergency room and that these people are sick. And that, you know, the hospital was built, I'm just going to say roughly 10 years ago. You know, it was an evolutionary build over a period of time. But the numbers of patients that the hospital was built to serve are a lot less than what we're actually seeing today. So we're trying to do the best we can with the space available. So we're always looking at the emergency department to see how we can enhance flow, provide higher quality service. In fact, the LHIN has just come in to do a study of flow in the emergency department, focusing on patients with mental health needs and what we can do there. And the report from that will be available shortly. We haven't seen that yet, but we anticipate that will be coming out in the next few weeks. So we'll be interested to see how that will work out. Helena alluded, though, to the fact that we're number one in pay for performance dollars because our physician initial assessment time is so short in the emergency room. So while it seems a long time when patients are waiting an hour and a half to see a physician, in fact, we're amongst the top performers in the province. And certainly, I think for our size hospital and the volumes that we're seeing, I would say we are the top performer in the province. So a lot of the lessons that we've got at South Lake, people are trying to come to us and learn, but it's a journey that we're on, and there's no question we can get better, so we're looking for all sorts of different ways that we can improve that.
Thank you.
Thank you. Councillor Hempin?
Thank you. And thank you both for the presentation, and thank you to all the staff who work at South Lake. I have a friend whose mother is actually in the cancer ward, and she was admitted 3 days ago, and she was talking about the level of care and courtesy she's been given, and she was very impressed with our hospital, and she could have gone to a hospital geographically closer to her, but she chose to come to South Lake, so it's a real testament to the hospital. I wanted to ask a question regarding the funding, the provincial funding. There was a mention of approximately, I think, $300 million from the province, our funding sources. As we live in an area that's really growing, and the catchment area for our hospital, and I heard comments that our funding has been frozen. The funds that we receive from the province, are they based on a per-patient basis? And maybe if you give us a little bit of an explanation on, does that funding grow as you see or as the hospital sees more patients?
Yeah, great question. So first of all, everyone in the province is frozen, right? All hospitals are frozen at a zero-based budget. Our inflationary pressures are between 2 and 3% per year. So we have to find 2 to 3% of our budget every year just to be able to break even. And we work very hard to be able to do that. So that's a broad, provincially shared challenge that everyone has. Right now we're in the midst of something called Health Services Funding Reform, which is volume-driven, and the dollars do follow the patient, and the allocation of dollars is based on the cost-effectiveness of the care delivered. And we believe that over the next few years, quality will be added into that. So it's not just cost-effective care, it will be cost-effective quality-based care that's very important. The ministry is now looking at funding what they call quality-based procedures. So you could pick something like cataract surgery, and the ministry's looked at the actual costs. There's, of course, a bell curve for the distribution of costs throughout the province, and I'm happy to say that our costs are amongst the lowest in the province. So every time we're able to perform cataract surgery, we generate a slight positive balance from that then goes into helping operating the rest of the hospital. So the global budget formula that used to exist in the past is slowly diminishing as health services funding reform is being rolled in over the next couple of years. This in and of itself is probably a 1-hour talk, and I'm more than happy to give you more of the information on this. But it's an interesting challenge, and we've, through our strategic plan, committed to being at the forefront of this. We don't want to be lagging behind. We actually want to be a model for the province on how to deliver quality-effective, cost-effective health care.
Thank you.
Thank you. And Councillor Kerwin.
Well, Dr. Williams and Helena, you've delivered nothing but wonderful news. I'm slated for surgery very shortly with the great Dr. John Randall. So, and I really like what you do with pre-op. I played a lot of sport in my youth, a lot of rugby, a lot of football. So finally, I'm going to address something that's been torn for years, and that's a rotator cuff, and I have it done here. But you look after the patient before, and you look after the patient after. So that's great news. As you're well aware, all the facilities basically, except for the arch that goes over into Ward 3, are in Ward 2. And there's another thing that you can compliment yourself on over the years. As you say, it's been an evolutionary build. And I couldn't be happier that the hospice is going ahead on Queen Street. I've been working with Dr. Merrill right from day one, and I've had the support of all of council on locating that hospice there. But most importantly, what you've done, as you say, with this evolutionary build, when you did South Lake, the residents were consulted. It's an intrusion into a residential area, an expansion into a residential area. And also when you expanded the cancer bunkers, there was an expansion into the residential areas. And it's been done diplomatically and so successfully because of the consultative approach to the residents in that area. And I must say, too, I just saw a couple of the houses with a demolition sticker on them that are going to be coming down. And once again, that gives us a greener area in that area. And the link with Sunny Hill Park, that it's a joint use that's been set up by the hospital and the town, where patients can come out from South Lake Village and from the hospital, and they can take a break in that green space. So I thank you for the past 17 years of being on board, working with the hospital, and creating this wonderful facility in Newmarket, in the center of town. It's not on the outskirts, it's right in the center of town. And that expansion has been done with almost no opposition or confrontation. It's just been a wonderful working relationship. And I thank people like yourself and Dan Carrier and Gary Ryan and Paul Clary. They've been great to work with. So not only is the hospital, but the way you did it, it's just first class. So thank you.
Thanks very much.
Thank you. Well, of course, 8 years of being on the hospital board, if not every other week, every week I'm attending either a finance and property or board meetings. And over the 8 years, I've seen a fabulous change in the hospital, particularly the focus on efficiency, focus on quality, and making it better. And I want to congratulate you and your senior staff in leading that type of transition for the hospital. It's a challenge. When you look at a $300 million budget and a 3% savings every year, that's $10 million you need to find just to stay even. And that keeps the Finance and Property Committee awake as well. But it's a challenge that the team is up to, and I congratulate you on that. So I appreciate you coming here telling us more about what we see when we drive by. All too often when we're in the hospital, we're in there because we need to have something attended to. And it's good for this council to see what really goes on in terms of economic drivers, in terms of transition, in terms of quality, in terms of leadership, in terms of commitment. All of that is alive and well in our hospital, and I congratulate you for that. So thank you very much.
Thank you very much.
Thank you. I have a motion then from Councillor Manuel and Councillor Twinney to A, extend the presentation time, and B, to receive the presentation. All those in favor? Don't forget to check the buttons. Good. Thank you, and that is carried. Thank you very much.
Thanks
very
very much.
informative.
Excellent. Well, on behalf of the South Lake team, thank you very, very much for giving us a chance tonight. It's a pleasure, and we do have our challenges, but it's always fun to come and share the successes. Thank you very much.
Thank you. Our next item is a deputation from Nicole Armstrong on behalf of the MS Society. Nicole? With deputations, we permit up to 5 minutes.
Good evening, everyone. My name is Nicole. I'm from the MS Society. As most of you know, I'm here every year. I can Okay. So this year, the MS Walk is on Sunday, May 4th, and it's at the Newmarket Community Center and Lions Hall. And our honorary chair is Councillor Sponga again, and we'd like to thank him for that. And I'm just here to invite everybody out for a fun day of raising awareness, out walking. We always have great entertainment, great food, and it's a lot of fun. So hopefully we see you guys there.
Thank you. Councillor Sponga?
Thank you. Nicole, it's always a pleasure to see you. You are an amazing person.
You're too kind.
You do so much for the community and the MS Society, and you've got your own plate full, so I can't believe you're doing this. You're incredible. You and, of course, Marianne Slattery, who isn't here tonight, and we're going to have to wrestle her out of the house because really miss having a presentation from her. So I can tell you we're all excited about seeing the MS Run come back downtown. It's really exciting to see that. And I know that we're working very diligently through a number of people. I know Councillor Emmanuel is helping me as well, and our commissioner in trying to get some of our Olympic stars out. So we're looking forward to that. And when is it again? May 4th?
May 4th. Yep, and it be there for 8:30 for registration, and 9 o'clock. Everybody's outside for the big rally, and away we go.
Thank you. How many years has this been going now? Uh-oh, trick question?
Between 17 and 20, I'd say. I've been volunteering for 17 years, so at least 18, 19, 20 years.
You started at 3?
Yeah.
Yeah, that's true.
I'm showing my true age.
Well, the society
A long time.
does a great job in terms of, bringing the community together and giving people an opportunity to make a difference in the lives of others. And for that, we really appreciate what you're doing. I know it's an awful lot of organization, an awful lot of hard work, but it's something that brings us together, something that brings the community together for a positive outcome. So we appreciate you coming out to give us the invitation.
Well, we always appreciate everyone from the town, their support, coming out, and everything that you guys do for us.
Thank you. Motion to receive, Councillor Sponga, Councillor Emmanuel.
Great. Thank you very much.
Thank you. All those in favor? And Councillor Kerwin and Councillor Sponga need to vote. Okay, that is carried. Thank you. Next item is the approval of the council minutes of March 24th. I have a motion with respect to the council minutes. Councillor Twinney, Councillor Emmanuel. Any discussion? Any corrections? Councillor DiMuccio, you're in the queue.
Yes, thank you, Mr. Mayor. I just wanted to, on page 25 under new business of the council minutes dated for March 24th, item number 56A, in which I requested that staff address questions with respect to the Newmarket Soccer Club, including the total loans, field fees, and mortgage amounts outstanding, and a status update of the sale of the Woodbine lands, and about the question that I had about who extended the credit for 2013 field fees. Those questions were emailed 3 weeks ago to staff, and I just wanted to, I know that staff had sent me an email that they were working on the answers. Can you just remind me once again, through you, Mr. Mayor, to the staff, when I would get those
Yeah, we could
answers?
follow that up.
I just wanted to know, yeah.
What we're doing right now is we're voting on the correctness of the minutes.
No,
And
I
we can
know.
bring this back up under new business, and
Well,
we can
or
do
we
it. That's
can-
the appropriate time to do that.
Okay, well, I just wanted to know when that was gonna, those questions, when I was gonna get an answer.
Okay, we can
If you
raise
want
that
me to
again
do it
under new
again under
business.
new business, that's fine.
That's correct. That's the appropriate time. Thank you. All those in favor? Any opposed? Councillor Vague, Councillor Hempin? Okay. Special Committee of the Whole minutes of April the 7th. Now, this is for confirmation only. There was a special council meeting which ratified, well, these are the minutes. This is the minutes of the special council meeting that ratified the Committee of the Whole. So could I have a motion with respect to the acceptance of the special committee of the whole of April the 7th? Councillor Sponga and Councillor Vague. Any corrections? All those in favor? Councillor Kerwin and Councillor DiMuccio? It's okay. Still a new process. Thank you. There is no new correspondence. Reports by regional representatives.
Thanks very much. Just want to report on a couple of things that have taken place in the last month at the region with reports that council and committee on. The one is in terms of child care support in York Region. The region has, we provided for child care fee assistance for about 1,200 additional children. And we've increased access to early intervention services for another 600 over the past 5 years. And so in 2014, we received an additional $7.4 million in provincial funding for these areas of great need. And through 2009 to 13, we received $19.3 million. And that was increased dollars linked to growth, which is something we've been really working at the region for quite some time and advocating for is a funding formula that recognizes areas with rapid growth. And so we were pleased to see that and have that reported out to us this past cycle at the region. Also, in a similar vein, we have a program, and it's also, I wanted to raise this to make sure that people were aware of it, but we have a program, it's a pilot program related to home repair for families to stay in their homes, and this can help seniors and disabled individuals do minor alterations like ramp installations or installing porch lifts. And we did have this report brought to us in council on the success of this program in this past year, helping 63 families stay in their homes, which obviously is a cost saving compared to the options that as opposed to staying in one's home. So just wanted to provide a little information on those two reports that we've received at council and the programs that are moving forward. Thank you.
Okay, thank you. Also, I'd like people to know that item number 12 of our committee of the whole talks about a noise exemption bylaw so that there will be construction in the evenings from 7 p.m. to 5 a.m. on Mulock Drive. And this is to be able to get the construction completed during the summer months and to do so while that corridor is not as busy as it was. Also, York Region Police is celebrating Asian Heritage Month, and over the years, partnerships with the communities and the community organizations have provided opportunities to learn about the many cultures that make up York Region. And this event will also highlight the music and the food, reflective of our connections to various regions around the world. They are inviting you, along with your family and friends and co-workers, to join them for the celebration. The admission is free, and it will be held on Saturday, Saturday from 11 till 3 o'clock, and I believe that's May the 3rd. So that's at the Don Hillock York Region new headquarters. Okay, Councillor Kerwin?
Yes, Mr. Mayor, through you, and I don't know, I'd have to ask Mr. Prentice, the sidewalk on Leslie Street on the east side from Gorham down to Mulock, would that be funded and through the region, or would that be a town project, Mr. Prentice?
Mr. Prentice?
Through you, Mr. Mayor, that would be a town responsibility, so it's something that the municipality would have to fund. It was brought up, I guess, most recently at their last committee of the whole meeting, at that gap in the infrastructure, and we will be putting it on our list for consideration when the 2015 capital budget is considered at a staff and council level.
I'd like to you, Mr. Mayor, to thank you for that. Also, I was going to bring up a correction under number 27. Even though the minutes were wrong on Leslie Street, our workers went out and did put a stabilization fence along on the west side of Leslie to prevent the Schomburg clay, or what I call gumbo, from coming down over the sidewalk. So even though the direction was incorrect, it was done actually from Gorham all the way right down to the Bogard Mill Trail. So the particular area was from Crowder, but around where the Bogard Mill Trail condos are, that's been done, and I really want to thank you, even though I don't need a correction there because they found out where it was, so thank you so much.
Thank you. Regional Councillor?
Yeah, thanks. Sorry, I just wanted to bring one thing also to attention, especially for the viewing public, is that there will be a public meeting, a public drop-in session on the proposed new annex building related to the regional, beside the regional building. So the new regional building's proposed. That meeting is an open house format from 6:30 to 8:30 on Thursday, the 1st of May, at the regional building. So for those who are interested in that proposed new regional building at the corner of Eagle and Yonge Street, again, the open house drop-in format, 6:30 to 8:30 on Thursday, the 1st of May. Thank you.
Good. Thank you. Next item then is reports of committee and staff. First item being the Committee of the Whole of April the 7th. Are there any items that members wish to deal with separately? Councillor Manuel, seconded by Councillor Sponga. All those in favor? Oh, that's right. We need a moment here for the system to catch up to us. And that was Councillor Manuel and Councillor Sponga, I think. Okay. And that carries. Thank you. Next item is the Committee of the Whole closed session of April the 7th, and this is for confirmation as the items within those minutes were ratified at a special council meeting. Motion to confirm. So moved. Councillor Kerwin, seconded by Councillor Vague. Any discussion? All those in favor? And that carries. Next item is bylaws. Bylaws number 2014 through to 2021. Mr. Clerk, if you could highlight those bylaws for us, please.
Yes, Mr. Mayor. The first bylaw is 2014-18, which is a bylaw to provide advanced voting dates and times for the 2014 municipal election. Bylaw 2014-19 is a bylaw authorizing the provision of election information in languages other than English and French. Bylaw 2014-20 is a bylaw to provide for alternative voting hours in designated institutions and retirements home, again for the election. And the final bylaw is 2014-21, which is a bylaw to provide for an exemption to the noise bylaw with respect to the works that you had mentioned earlier.
Thank you. Does anyone wish any of these bylaws to be dealt with separately?
Second.
Okay. Councillor Emmanuel and Councillor Sponga. All those in favor? Councillor Twitty? Okay, good. Thank you, and that is passed. Notices of motion. Announcements and community events. Councillor Emmanuel, start.
Thank you, Mr. Mayor. Just a quick announcement that reminding residents that yard waste collection has begun and will continue on a bi-weekly basis until November. Please remember to bundle branches separately and place plant trimmings and weeds into paper yard bags or rigid containers with handles. Due to weight restrictions, please keep excess dirt out of the bags. For more information, visit newmarket.ca or call us at 905-895-5193 or download our handy My Waste app as well. Thank you, Mr. Mayor.
Thank you. Councillor Mucho.
Thank you, Mr. Mayor. Good evening. The Easter Bunny will be hopping along historic Main Street South on April 19th from 10 a.m. to 3 p.m., giving out free treats to all of the kids. Participating businesses will also be displaying Easter eggs in their windows. If you count them up and fill out a ballot to win some exceptional prizes from the Main Street merchants. Get your ballots from British Imports Sweets in Store or Good Vibes on Main. Also, remember to visit What's Not Craft Studio and enter a free coloring contest. For more information, please visit www.newmarketmainstreet.ca. Thank you.
Thank you. Councillor Sponga.
Thank you, Mr. Mayor. Through you, first of all, Ward 5 residents are invited to our ward meeting on Tuesday, April 29th at 7:30 p.m. at the Community Center and Lions Hall at 200 Doug Duncan Drive. Come and hear about what's going on in our town and specifically in your ward, and hope to see you all there. For more information, please call 905-895-5193 or email me at jsponga, JSPONGA, @newmarket.ca for further information. Also, the town, please help the town of Newmarket fill the shelves of the Newmarket Food Pantry for the Newmarket Food Pantry Spring Drive. And our town food drive is actually collecting food here in our lobby, and our food drive goes until April 18th. If you wish to drop off some very much needed food for the pantry, please do so, or call 895-5193 for more information, or you can call directly the food pantry at 905-895-6823. Also, it's my great pleasure this year, because it's been a real long winter, to say that May 3rd, the farmers market is going to start. So it's about time, and looking forward to seeing everyone at the Riverwalk Commons. And this year, again, there will be lots of local farmers, lots of local food vendors, artisans, and we're crossing our fingers, hopefully a VQA local winery as well. That would really put the icing on the cake. And that's it for tonight, Mr. Mayor.
Thank you. Councillor Hempin.
Thank you. My community announcement is regarding the Canada celebration and the town looking for some entertainment. The town of Newmarket is looking for a lively, entertaining band to play a variety of popular cover music on July 1st as part of the Canada celebration at Fairy Lake Park. The band must be available from 11 a.m. to 4 p.m., supply their own sound equipment, have music between sets, and perform rain or shine. Interested bands are asked to drop off a recent sample of their music, a bio, and a fee they expect to the Ray Twinney Complex at 100 Eagle Street West to the attention of Rhonda Pogue. All submissions must be made by 4 p.m. on April 25th. You can contact Rhonda at 905-953-5301 for more information. And I'd also like to mention that we're having a Ward 4 cleanup day on May 4th. That's Sunday, May 4th. We'll be meeting at Denison Public School, and I ask that residents of Ward 4 come out, and we're going to be spending the morning from 10 a.m. till 12 p.m. cleaning up the ward and picking up some of the trash. So thank you very much.
Thank you. Regional Councillor.
Thanks. Just wanted to mention that coming up April 27th, Sunday, April the 27th, is the annual Nature's Emporium Run or Walk for South Lake. It's a very important event in our community in supporting South Lake, and we heard about the amazing work they do earlier. So that's on Sunday, April the 27th at the Aurora Community Center. You can register at runforsouthlake.ca. There's a 10K, a 5K, and a 2.5K run or walk. And also there's a great kids mini mile and kids zone there, so there's a lot to do. There's an amazing opportunity for anybody in the community to go to runforsouthlake.ca and register and support our hospital and the great work we've heard from earlier today. Also just want to mention that on May the 6th and 7th at the Sony Centre in Toronto is the new apartment construction and housing symposium. And I'm going to be speaking at that symposium on the need for rental housing, in particular in the York region, but in the GTA, and how we can collaborate across the public and private sector to see an increase in rental housing. And that's on May the 6th and 7th at the Sony Centre. Thank you.
Thank you. Councillor Twinney.
Thank you, Mr. Mayor. Casey's Cancer Cushion Fund Pub Night takes place Saturday, April 26th at the Newmarket Seniors Meeting Place at 474 Davis Drive. This evening begins at 7:30 p.m. and features live entertainment, a late lunch, door prizes, and more. Tickets are $30, and the funds that are raised from this will help give financial support to families in need going through cancer treatment. If you'd like to come out and support this event, it's a great fun night. I've been many times, and I can vouch that it's certainly a fun night to go out. The tickets are available. You can call Debbie at 905-715-7717 or purchase online at www.cushionfund.com. I also like to take this opportunity to acknowledge that May 1st is First Responders Day, and it's acknowledging our first responders, the men and women who are responsible for the protection and preservation of life, property, and evidence and the environment. So I'd like to just make that announcement because I don't believe we have another council meeting before the May 1st. And also on behalf of council and as the chair of Joint Council Fire Services, I'd like to send my sympathies to the residents of Aurora and the congregation of the United Church that had lost their church on Friday through a fire, and our condolences sent to their residents as they go through this hard time.
Councillor Kerwin.
Yes, thank you, Mr. Mayor. Join us for the 36th Annual Holland River and Community Cleanup on Saturday, May the 3rd. And Councillor Emanuel, that took place before you were born, so you weren't able to participate in all 36 of them, but I know you'll be out there. And notice the change. The kickoff will be at the Newmarket Youth and Recreation Center at 56 Charles Street. Enjoy a coffee before heading off to help with the cleanup. Registration begins at 8:30 a.m. and cleanup begins at 9 a.m. until noon. And gloves and garbage bags are provided. Following the cleanup, and this is normally the Rotarians, provide a barbecue, so there's a free lunch. Stay and take part in the Youth Center's Family Fun Day, which runs until 4 p.m. So please notice the change. It's not back of the town offices at 395 Mulock. It's a shift over to the Youth Center, which is on Charles Street. So please be there. I also have a fond announcement that Kelly Jones will be turning 50 on April the 28th. And she is the wife of Brad Jones. I had the pleasure of teaching her many years ago, but what is noticeable is that this young lady will be taking off shortly to walk the full 700 kilometers for the El Camino de Santiago de Compostela, which is the holy trail that runs all the way from France to the north west corner of Spain. 700 kilometers. So, Kelly, we wish you all the best, and it's a pleasure, and there's sort of a kickoff night on April the 19th at Colonel Mustard. Also, one other announcement, or two other announcements, that the mayor and I had the pleasure of attending the 50th anniversary of Lloyd and Purcell. That was held at Red Crest this past Friday night. And we wish you another 50 years of success. And it was just a wonderful evening. You don't really see a father and son operation like this continue for 50 years. When after Charles Lloyd died, it was run by Jim Purcell, and then his son Murray came on board, and they employ over 30 people. So congratulations. That was just a great event. Also, I will be at the library again this Saturday, the 19th and the 26th, from 9:30 a.m. until 12. I stay there until 12. And there are all kinds of rooms for residents to come out and talk with me about any ward issues or any town issues. Thank you, Mr. Mayor. No further announcements.
Thank you. Councillor Bay.
Thank you. I'd like to say that our cold, severe winter has come to an end, but I see in the forecast that we're going to be having a bit of snow tonight. I cannot believe that. But because of the cold and severe winter that we had, it's really taken a toll on our roads, particularly in the area of potholes. And while we do have the town crews out there, and we thank everybody for their patience, we are identifying them and repairing them as quickly as we can. Some weather days are cooperating. I think tomorrow's weather will not cooperate on this type of work. But we also ask residents, if you see a significant pothole, please call us and let us know. You really are the eyes of your community, and even though we're doing our best to try to cover every street, we do depend on residents on contacting us. And if you do see a significant pothole, please call us. The number here will be 905-895-5193, or you can email us at info@newmarket.ca, or if you do have MyWaste app, and I hope you do get that, you can just select Report a Problem and provide that information for us. Also, related to this cold and severe winter and all the heaving ground that we have, on your driveways or on your lawns, you might be noticing you have protruding water caps. If that is the case, please do contact the town. Once again, at the same number, the 5193 or emailing us at info@newmarket.ca. We'll come and lower that cap for you for free. They do become trip hazards and certainly can damage the blade for your lawnmower if you don't take care of it. So again, we'll lower that for free. Just let us know where that protruding cap is. Thank you.
Thank you. I want to congratulate Dr. Chris Ganage and his many volunteers who organized Docs on Ice at the Magna Center. The event brought more than 900 doctors into Newmarket, and they raised $275,000 for the Canadian Mental Health Association, and that's going to be used to establish a new mental health program for youth in York Region. The MC for the evening was the voice of the Maple Leafs, Andy Frost, and Rick Mercer provided a lively entertainment and insight into the evening. But what struck me the most was the many times that people came over to me to tell me what a great job staff had done from the very beginning in organizing the event right through to the day of delivery to make sure that everything was ready. And Mr. Shelton, I'd like you to extend our appreciation to our staff for doing a great job. If anyone has anything that they wish to discuss with me, I will be at the Mayor in the Square at the Newmarket Public Library on Friday, May the 2nd, from 11 until noon. And the town offices will be closed for Easter beginning Friday, April the 18th, and will reopen on Tuesday, April 22nd. And our next council meeting is May the 5th at 7 p.m. New business. Councilor DiMuccio?
I just wanted to ask staff through you when we would be getting those questions answered to talk about. I know that you had sent an email, but if you could just remind us.
Yeah, through you, Mr. Mayor, to Councillor DiMuccio. Following the new business at council, an email was sent the next morning to all members of council inviting any questions to be received, and it would be addressed within the Q1 report regarding the Newmarket Soccer Club. So 2 councillors did respond to that invitation for questions, and all those questions were summarized and addressed and answered as part of the Q1 report, which was referenced earlier. It's number 2014-12. It's a public information report that was dated April the 5th.
And I believe that was circulated on April the 4th. Good.
May I please have that report on the next council agenda, please?
Okay, yep, I think that's the protocol.
Thank
Yep.
you.
Any information report can come forward to the next committee of the whole meeting.
If the clerk can arrange that. Thank you.
Well, the report's there, so we can include that in the agenda. Okay, thank you. Any other items under new business? Closed session is not required. Confirmatory bylaw. Councillor Sponga. Councillor Kerwin. Waiting for the system to catch up to us. All those in favor? And that is carried. No addendum. Adjournment. Councillor Manu. Councillor Sponga. We're waiting here. All those in favor? And that carries. We're adjourned.